Chromium has been found to help in glucose breakdown. Thus, a deficiency in chromium has been linked to an increased risk of prediabetes, the stage that precedes a type 2 diabetes diagnosis. Chromium is an essential mineral that appears to have a beneficial role in the regulation and its effect on carbohydrate, protein and lipid metabolism. Moreover, studies have shown that people with type 2 diabetes have lower blood levels of chromium than those without the disease. Chromium supplements have been demonstrated to enhance the metabolic action of insulin and lower some of the risk factors for cardiovascular disease, particularly in overweight individuals. Chromium picolinate, in particular, has been shown to reduce insulin resistance and to help reduce the risk of cardiovascular disease and type 2 diabetes. However, there is still limited research on the exact amount of chromium required for optimal health. One of the most commonly cited intervention studies on the effects of chromium supplementation for type 2 diabetes was a randomized trial that included 180 adults. The participants were aged between 35 to 65 years, and all had been diagnosed with type 2 diabetes. They were divided into 3 groups, one of which received 1,000 micrograms a day, while a second group received just 200 micrograms a day. The third was administered a placebo. At both 2 and 4 months into the study, participants receiving the higher dose of chromium had significantly lower glucose concentrations than those receiving placebo or lower doses of chromium. Chromium sources. While researchers have demonstrated the benefits of chromium picolinate supplementation for some people, other experts believe diet remains the best source of chromium. Chromium is present in many foods, including meat, grain products, fruits, vegetables, brewers' yeast, beer, wine. However, chromium amounts in these foods will vary widely depending on the condition of the water and soil, as well as the manufacturing procedures used to produce them. Researchers also point out that most dairy products and foods high in sugar are low in chromium. Diabetes. The first step in the development of type 2 diabetes is prediabetes, which means that the blood sugar level is higher than normal, but not yet high enough to be type 2 diabetes. However, the long-term damage of diabetes, especially to the heart, blood vessels and kidneys, may already be starting. Furthermore, the same factors that increase the risk for developing type 2 diabetes, increase the risk for prediabetes, including high blood pressure, family history of diabetes, and lack of physical fitness. Some lifestyle changes can prevent the onset of prediabetes, and allow better management of type 2 diabetes. Symptoms of type 2 diabetes. According to the NHS, symptoms of type 2 diabetes include peeing more than usual, feeling thirsty all the time, feeling very tired, losing weight, itching around the penis or vagina, or repeatedly getting thrush cuts of wounds taking longer to heal. The health body said, a GP can diagnose diabetes. You'll need to do a blood test, which you may have to go to your local health center for. The earlier the diabetes is diagnosed and treatment started, the better. Early treatment reduces your risk of other health problems. Related articles. Pfizer vaccine, 4 troubling side effects that follow second jab. The anti-aging drink that can regulate cholesterol and blood pressure. Fatty liver disease, signs of cirrhosis,